Uh, we move on now to Sharon White, who is the manager of the Medical and Engineering Technology, the Met Gateway in GMIT. And it's not that long since Sharon presented to ourselves in Udra, so I know she has a lot of knowledge to share with you. So Cormac thoughts with Sharon.
Thanks very much. Can you hear me okay?
Yes.
Yeah, lovely. Thanks very much, Sinead, and thanks for asking me to be part of your event today. As Sinead said, my name is Sharon White. I'm the Technology Gateway Manager at the Met Technology Gateway. So Katrina Murphy and Katrina Power have spoken about some of our sister gateways across the country, and I'll give a little bit more detail on who we are, what we do, and how we can support your company and your business. Sorry. So just a little bit of information on us ourselves at the Met Technology Gateway to start off. We are an applied research centre and we're dedicated to supporting research development and innovation activities, primarily in the medtech, life sciences and engineering sectors. We're located in GMIT. We're in the Galway campus on the Dublin Road. We were established in our current format in 2016, but the expertise that we have is based on a very long history of biomedical and biomedical engineering research within GMIT. So similar to the other gateways in the network, we're supported by Enterprise Ireland, and we're run in conjunction with GMIT. And our core mission is to generate solutions for the close to market needs for companies and to provide open access to industry to the technological and research expertise within GMIT. We ourselves at Met have over 20 researchers engaged in the centre, and that involves staff and students from multiple academic departments, including the Department of Mechanical and Industrial Engineering, Biopharmaceutical and Medical Science, the Department of Natural Sciences, Computer Science and Applied Physics, and we've also worked in conjunction with GMIT and Letterfrac. And we offer expertise over a range of technology themes. So I'm just going to give a brief overview of what we offer, but please, if anyone has any further questions or would like any further information, please don't hesitate to reach out to me, either to ask a question later on or to reach out after the webinar. So we offer support to industry across 5 technology themes, the first of which is medical imaging technologies. So what this does is we actually offer imaging technologies, the spaces for rent, essentially for our industry partners. And this allows for prototype devices to be tested and evaluated under clinically relevant simulated use conditions. Our suite of medical imaging equipment includes ultrasound imaging, but we also have a new purpose-built medical imaging suite on site in GMIT, which boasts our new state-of-the-art Philips Azurion digital fluoroscope. Again, this is for use for our industry, academic and research partners. Our second theme then is anatomical modelling and physiological replication. And this involves the translation of medical data such as MRIs or ultrasounds into engineering data. And from that, we generate clinically relevant anatomical models. They can be used with our fluoroscope as well. And they're fully compliant and we can replicate healthy or diseased tissue within the model. We also specialize in developing advanced simulation systems to go with the models. And essentially what they do is replicate the physiological parameters such as pulsatile flow and blood pressure within the model, essentially giving a fully clinically relevant anatomical setup for the testing and verification of devices. Our third theme is data analytics, and under this theme we offer expertise in the visualization of clinical data, which can help inform the design of next generation medical devices. We have the expertise to manipulate, interrogate and visualize industry data in any volume. Our fourth technology theme is design engineering and verification. And under this theme, we offer capabilities in prototyping, design verification technologies such as CAD design, rapid prototyping, technical reviews and critique, brainstorming, and materials and products characterization. We have capabilities such as tensile testers, viscometers, 3D printers. We have a CNC machine. So really this is aimed at supporting SMEs and small companies to gain access to these types of equipment that they may not necessarily have to hand. And last but by no means least, under our medicinal nutrition and sport team, our research team offers leading expertise in nutrition and sports science. The MET team can assist the food industry in all aspects of novel food development, and we have the knowledge and skills to test and modify the impact of foods on physiological and metabolic parameters. We also have a range of sports testing equipment and technologies that are available at our centre that can enable companies to develop food and strategies specific to athletes and those involved in sport. So it's just a quick whistle-stop tour of MET and what we offer in terms of support to industry. So as I said earlier, really the main focus of what we do is support the medtech industry. And the industry itself is hugely important in Ireland, and it is recognised as one of the global emerging hubs for medtech. We contribute hugely to the exports or the export of the country, with over 12.6 billion in exports that's growing year on year. We're the highest employer in medtech per capita in Europe, with over 40,000 people in the country employed in the sector. And Ireland has a recognised skilled workforce and a talent pool. And this is supported through our academic institutions that provide industry-specific education and training to, I suppose, ensure throughput and ensure that talent pool will continue to exist and grow here in the country. And because of this, we've 9 of the world's top 10 medtech companies here in Ireland. And within the industry itself, there's over 450 companies. And for me, one of the most important metrics here is that 60% of those companies are Indigenous, which I think is just absolutely incredible and is really a testament to the level of innovation that Ireland brings to the medtech industry as a whole. In terms of some of the trends that we see through our interactions with the industry, firstly, and really this is probably by far and away the biggest of them, and that's digital health. This is a huge emerging trend coming out of the medtech industry at the moment. And similar to Katrina Power, based in MTU, GMIT will shortly be generating a cluster specifically to support digital health industries going forward. We're currently hiring for the role of educational outreach manager for that position. So I suppose it's for us, it's really a recognition of the amount of activity that there is in that area at the moment. One thing that had kind of come up as well for us, I suppose really because of COVID, more so than anything else, was the idea of remote healthcare. Even just simple things, how can you make it such that the doctor doesn't necessarily have to enter the room, in particular where you have a highly transmissible virus. But even how can you address healthcare from remote locations when people can't travel? So that's something that we had seen that came out as part of the COVID-19 conversation. And as with a lot of other industries, digitalization and Industry 4.0 are very big on the medtech radar as well at the moment. Improvement of the manufacturing processes, and medtech in particular has always been a very human and manual labor-intensive industry. So the move to digitalization and Industry 4.0 for that industry is a huge change, but I know it's certainly something that has a huge amount of momentum behind it at the moment. And of course, like many other companies as well, the sustainability and circular economy is something that's high on the medtech radar as well, which comes with its own challenges specific to that industry, in particular looking at device design and trying to make them as sustainable as possible. Obviously with medical devices, it's not always possible to have them reusable, so that comes with huge changes for the industry as well. just to speak a little bit about the Technology Gateway Network, as I said, Katrina Power and Katrina Murphy have already mentioned some of our colleagues, but just to give you an idea of what the network is, what we do, and how we can support you and your company. So if I were to say in one sentence, what is the Technology Gateway Network? Well, to me, it's 15 centres of research and R&D excellence that are there to work with industry. And that's really very quick snapshot of who and what we are. So we serve as a portal through which companies can engage with academic research on a local and national scale. So as I said, we ourselves are based in GMIT, but through us, if we don't have a specific expertise that you're looking for, we can certainly work or we can find that expertise either within the network or across the research base in the country. As I mentioned earlier, we're supported by Enterprise Ireland and operated in partnership with the Institutes of Technology and the technological universities. We're aimed at increasing the level of interaction between industry and the Institutes of Technology and the technological universities. And it's really about trying to support and nurture that research development and innovation activities within the companies to help them grow. We support industries of all sizes, startups, SMEs, multinationals, right across the board. And each centre then works in conjunction with industry to aid the RD&I activities within the company. I suppose one of the things that's very important to us, very close to our heart, is the fact that we're, thanks Sinead, the fact that we're regionally focused and we're based all around the country. This is just a snapshot really to give you an idea of the length and breadth of expertise across the network, so we can support you in everything across the board. As I said, we ourselves are based in medtech, but there's everything and anything from applied design, applied biotechnology, coatings, connected media, precision engineering, engineering materials, and polymer expertise. So it's very broad in terms of the expertise across the network. There are also 3 clusters that are again within the network, and we work. We are grouped together under common technology themes. The first one is EMD, which is engineering materials design. We cover everything from precision engineering, polymers, coatings, and prototype design. The Irish Food Tech cluster then looks at areas of bioprocessing, process control, biodiagnostics, and applied biotechnology. And then the applied IoT cluster covers everything from mobile services, connected media, RFID, and wireless technologies. Just to speak a little bit firstly about the vouchers before I go on to the innovation partnership. So Katrina Murphy mentioned the innovation vouchers. So really the innovation vouchers I see it as kind of step 1 on your RD&I and collaboration journey when it comes to working with RPOs. So the innovation vouchers, there's 2 types. One is worth €5,000 and the other is worth 10,000, which is co-funded with the company. You're entitled to 3 vouchers each company. So 2 of those would be the standard and 1 would be the co-funded. So essentially, you know, if you use them together, which a lot of companies do, you would essentially get €20,000 worth of research and development carried out on your behalf for about €5,000. So the only catch is that you would be liable for the VAT, which of course you can claim back. So they're a really good way to kind of dip your toe in terms of just starting and investigating how well collaborative research could work for you. So I would definitely recommend, I can give you some more information on the scheme, but definitely a great way to kind of start that process. And then just very briefly, I suppose moving on then from the innovation vouchers into the slightly larger funds, which is the innovation partnership. And this again is all about building collaboration between companies and public sector knowledge providers. They're co-funded by the company, so you would be expected to put up a minimum of 20% of the overall fund, and you would be funded up to 80% by Enterprise Ireland, up to a max of 200,000. It's a two-phase application process, but the one thing I wanted to really highlight to you was option 2 there for phase 1 is the Innovation Partnership Feasibility Study. So if you're not sure if there's a particular technology you'd like to explore and you're not sure whether it's going to work and you don't want to go down the road of a larger innovation partnership, you can apply for this grant, which is 100% grant funded. It's worth €9,000. And again, it's a great way to just try it out, see is the technology going to work for you? And if it is, then you can use that to move on to the larger innovation partnership to further develop it. For smaller companies, then there's also the Innovation Partnership Express, which is a shorter time to funding decision, which is 4 to 5 weeks, with a maximum project value of 85,000 and a maximum EI contribution of 68,000 for that. So that's just a quick overview of some engagement. Of some methods of engagement, but I'm happy to provide any further information or answer any questions that you may have. Thanks very much.
Thank you very, very much,